For more on what's happening there on the ground in Mississippi, joining us is Dr. Randy Roth. He's Chief Medical Officer at Singing River Health System in Mississippi. It's good to have you with us. Your hospital system, Dr. Roth, tweeted, "Our situation is indescribable," noting the influx of patients was pretty much preventable. What are you seeing this morning?
We're seeing the point of full capacity. It is to the point where we're shutting down elective procedures like bypass surgeries, things that people need, even some early cancer surgeries that we're not going to be able to staff. The morale is low. Our staff is overworked. They're doing a lot of overtime to cover things. We're taking great care of patients still, but the surge is still rising, and I'm not sure that we're going to be able to meet the demands that we're seeing in the future.
I'm just going to let that sink in for a minute. The concern that you won't be able to meet the demand. You bring up the staffing concerns as well. I spoke earlier this week with a nurse who is also in the Singing River Health System who told me she had just submitted her resignation because she's so exhausted. She's an ICU nurse. She's so burnt out. Here's a little bit more of the picture that she painted for us earlier this week.
I work in a 12-bed ICU. All 12 patients right now are COVID. They are all unvaccinated. We do not have a fully vaccinated person in that ICU, and they are young. We are watching not grandparents this time around, parents with young children. We have a mother right now who has never held her newborn baby. To call us heroes, but not do what you can to protect yourself and to protect us, it's just words, and words don't save lives. Actions save lives.
Actions save lives. You have really made it a priority to reach out to the community, I know, to encourage more people to get vaccinated, to do their part. You wrote earlier this month, choosing not to get vaccinated, which is everyone's right, puts unvaccinated people at significantly increased risk. How much of an impact do you think your outreach is having?
One person at a time. If I can save one life, if I can approach students, if I can approach church groups, minority groups, and get in front of them and just get them to believe in the vaccination, it's worth it. That nurse, I know her very well. The difference between the first wave and this wave is that we're seeing 30 and 35-year-old and 40-year-old patients die. And when you talk about withdrawal of care and you're speaking to their brothers and sisters or their parents, instead of dealing with an 80-year-old that's kind of in that circle of life where it's supposed to happen, it's devastating. From a spiritual and emotional standpoint, there's only so much this our nurses and frontline people can take. So it is about one shot at a time, one vaccination at a time. Trust, and please get vaccinated. Right now, out of our 140 inpatients, about 12 or 13 have completed their vaccination cycle. So it's not bulletproof, but it sure is a good first step.
You talk about the lasting impact. I can remember at the start of the pandemic here in New York City, talking with a cardiologist who had been repurposed back to the emergency room to help with the influx of patients, of COVID-19 patients. And she talked to me about her very real concerns for the lingering PTSD that, frontline workers wouldn't start to experience for at least a year. But now we're seeing, it's sort of compounded. You just touched on that, but in terms of available resources, do the staff, are they even finding the time to take advantage of those resources, to take care of themselves, to deal with what they're seeing on a daily basis?
We advocate for all of our employees, our medical staff included, to, you have to take time for yourself, whether it's physical exercise, going home to your family, taking some time. But, we signed up for this, and I don't think that I can expect a lot of our nurses and doctors just to walk away. They're putting in extra hours, and not only the extra hours, but the intensity of the work is unbelievable. I've never been in the service. I'm not military, but I would imagine it's very consistent with what they see in the field, and having to make decisions about life and death. The isolation of this disease, patients in the ICU and our ER unable to have family and visitors, puts an extra amount of stress on our staff to communicate over the phone to their families and make these decisions that are so hard to make. We do offer services to our employees, and some do take advantage of it. We have certain rooms where they can go to and rest. But right now, it just seems like they keep coming, and we're going to do everything we can to take great care of them.
Really quickly, the governor extended the state's emergency order for another 30 days, but did say there would be no more lockdowns or mask mandates. Would you like to see some mask mandates in place?
Obviously the masking is controversial, it's political, it's very polarizing. But from my standpoint, having 4 adolescents in high school, I'm not sure what he's waiting for. These kids need to be in school. I think they learn better than being virtual. And I would advocate for a mask mandate, at least until we see a decline. The number of cases that we're seeing positive every day continues to algorithmically go up. So we can do 4 things. We can mask, we can wash hands, we can socially distance, and we can get vaccinated. I would advocate that we do all 4 of those.
Dr. Randy Roth, thank you for your time this morning, and thank you for everything that you and your staff are doing.
Thank you.